The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, today on Aging Horizons we're going to be talking about Medicare and Medicare fraud with our SMP Director Renee Labrie-Shanks. SMP stands for Senior Medicare Patrol, and it's a group of advocates in our state who make sure that Medicare beneficiaries have advocacy if they think something is going kind of hinky with their bill. We have a lot of information for you and some great stuff to tell you about, so stay with us.
45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up and I lost it all. I knew smoking was expensive, but I never thought it would cost me everything.
The human heart, even at its strongest, it's a fragile muscle. Chest and arm pain, shortness of breath are signs of a heart under attack. But 3 numbers can save a life. Dial 911 at the first sign of a heart attack. Quick response from medical experts can save your life.
I was 45 and it happened to me, a heart attack.
Dialing 911 saved Ryan's life. Now he's here and he's healthy.
This message sponsored by Mission Lifeline Montana.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Hello everyone and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kimmy Everman, and today we're going to be talking about Medicare and Medicare fraud. As a Medicare beneficiary, you want to keep your benefits as safe as you can possibly keep them. You don't want anybody getting a hold of your Medicare card or numbers, and it just can be a real hassle if that happens. And so what we have, luckily, is a great group of advocates in our state called the SMP, the Senior Medicare Patrol, and with us today is the director of that program, Renee Labrie-Shanks. Welcome, Renee. Glad to have you back.
Thank you for having me.
Sure. So, we're in a new year. We want to just give everybody, that same kind of a chance to take a look at all of their all their benefits and make sure that they're being used well. And one of the things we want to really watch for is any kind of Medicare fraud. Now, your group is really involved with that. Will you tell us a bit just generally about the SMP and what you do?
Yes, thank you. It is a national program, so every state and U.S. Protectorate has an SMP in their state. Ours is out of the Missoula Aging Services Office, which is the Area 7 Agency on Aging in Montana, and it's partnered across Montana through the Area Agencies on Aging Network. So every area has a local SMP office. And what we are the third piece of a puzzle, I like to say. We are the ones who help people understand their bills, explain the bills. We'll research if somebody thinks there's something wrong with the bills. That's what our role is. And then the Office of Inspector General, they're the ones that actually investigate fraud. And then the Department of Justice would prosecute. So if there is fraud, we wrap it up in a little package and tie it with a bow and send it off to them. But our main job is to educate beneficiaries and people on Medicare and their caregivers and make them understand what's at stake and how they can be a part of that in stopping the fraud.
Yeah. And why do you think a proactive approach like that is so important, Renee?
Well, it's so much easier to not lose the money in the first place.
Right.
It's so much easier than trying to recoup it after it's been stolen. That's why we keep our doors locked. And, you don't want someone to come in and steal stuff. You want to keep it from happening in the first place. And that's our number one role. Keep it from happening by education and by informing people on the clear steps that they can take, because the people are in charge of this. They are the number one line of defense. They're the ones that can actually stop the millions and billions of dollars from rolling out.
Yeah, Renee, what about the folks that are actually SMP workers? Are they specially trained? I mean, who are they?
Yes, thank you. SMP is being a national program, has national training, and Medicare itself is a part of that. They go through training to be a SHIP counselor, usually first, which is the State Health Insurance Assistance Program. And they're out helping people enroll in programs and understanding their benefits. And then SMP, the other side of the coin, we always like to say is, what is the fraud and how to stop it and how to be a part of that. And so we do train everyone, and we utilize volunteers as well that are also trained to help. And mainly the goal of this is education. So the staff and myself would probably be running with the cases to try and figure that out. And we need a huge boots on the ground helping us get the message out there across the state, because we've got a big state.
So with that in mind, Renee, what if they want to be a SMP worker? How should they reach out to you or to Medicare?
Right. Well, they would reach out to our local SMPs. So they would call the local 1-800-551-3191. That would get them to their local office on aging and ask about it there. And across the state, we utilize volunteers differently depending on our agency and the needs are in our communities. We do have goals to get out there and help provide presentations once COVID and the pandemic allows us. And that'll be a huge swing once this ends, is we will be looking for people to help. And we provide the messaging, we provide the training. We just need boots on the ground to help us get the message out.
Sure. That sounds pretty easy for folks that want to do a little volunteering and really just want to show up. I mean, that's kind of how I feel. I'd like to show up, be given, as you said, all those talking points, and then move on.
Yes. And if you're part of a group, that could just be who you provide the information to. You don't have to go around town to different groups. You can just be at the group that you're associated with and be our liaison, as it were, to help get the message out.
That's great. That would really be, I bet, comforting to people who might be a little nervous at first to have just one group of folks to work with, and plus get to know them very well.
Mm-hmm.
Yeah,
definitely.
So if they want to be SMP worker, they should reach out to one of the area agencies on aging, and they can call that 1-800 number. That we'll run that on the screen, and just sort of get the idea of what it's all about. And I'm assuming that these volunteers can kind of make their own schedules and really do the best they can with the time they have.
Yes, a lot of flexibility. And again, once the pandemic's over, we'll probably be looking really wide and far for some more people to help out. Right now, we're kind of in a state of doing what we can without the ability to get in front of crowds of people right now. So if people do need help with their statements, understanding something, they don't think they were billed right or something, that they still call that area agency number and get their local SMP for help.
Okay, awesome. Well, folks, we have a whole lot more to tell you about. Medicare fraud is not huge in our state, but it's here, and we want to make sure that we fight against it. So stay with us. We have a whole lot more to tell you.
have so many questions about power of attorney.
Well, some powers of attorney are for finances and others are for healthcare decisions.
A power of attorney designates an agent who would make decisions on your behalf.
While making a power of attorney, you have the ability to control your agent's power.
You also have the ability to decide when that POA would take effect.
Wait, am I giving away all my rights?
Power of attorney isn't a license to make any decision for you, just those that you've specified.
Your agent should be somebody that's working in your best interest, but it should also be somebody that you would trust.
What if they try to abuse their power?
Protective measures like third-party accounting, secondary signatures, defined spending and gifting limits can help protect against financial exploitation. An agent's powers can always be limited by a customized power of attorney, and they can be revoked by you or the court if the power of attorney is abused.
So carefully drafted estate planning documents can help ensure that your finances are monitored, but not abused.
If you or someone you know is being exploited, please report to Aging Services Bureau at 844-277-9300 or the Legal Service Developer at 1-800-332-2272. This message sponsored by the DPHHS Aging Service Bureau.
I take care of my wife at home. When I found out training was available, I said, sign me up. It's made a huge difference.
When my husband was injured at work, it was life-altering. The class has taught me that it's okay to grieve, to ask for help, and to better cope as a caregiver.
My dad lives 4 hours away, and the Powerful Tools class has taught me that it's okay to ask for help. I highly recommend them.
To find out about this course for caregivers, go to powerfultoolsforcaregivers.org.
It's amazing the difference a little training can make.
Flight 109, is that Evel Knievel on the runway?
Whoa, Daredevil! You need a Montana Real ID to fly. Go to mtrealid.gov to make an appointment.
Looks easier than jumping a canyon.
Smile. I see you changed your name from Robert to Evil. Did you bring your name change documentation?
I'm not trying to pull a stunt. Got the paperwork right there.
Go to mtrealid.gov.
Now I can fly! It's that easy.
Hello everyone, welcome back to Aging Horizons. We're here talking about Medicare fraud today with Renee Labrie-Shanks of the Montana SMP program. And in a few minutes, we're going to talk about some of the scams that are out there right now that you should be aware of. But I think first thing we're going to do is just talk about how to fight the fraud in the first place. And we have back with us Renee Labrie-Shanks. Renee, hi.
Hello.
So, you know, I always like to hear about the scams, but let's put that aside for a minute and just talk about what does a person do to fight this kind of fraud? What's their best line of defense?
And I've got an easy answer for you. And, you know, when we're talking about this fraud, we're talking about $60 billion a year nationally, which is huge. We spend, $42 billion on Homeland Security, and we're losing more than that just in the Medicare fraud alone. So we have to stop it. And the number one way to stop it is everyone opening up their Medicare summary notices or their explanation of benefits from the Medicare Advantage companies and reading them. And that is it. And they don't need to be, medical billing specialists to understand what they're looking at, actually. We want to explain to them in no uncertain terms that they're the ones who are in charge. They're the ones that know who they saw. You know, if they saw a provider or not, that would be a key. If they recognize the providers, if they recognize the date of service. And note that the MSNs and the EOBs both are not bills. They're just telling you what was billed to Medicare or Medicare Advantage in their name. So this will show them things that they may never see a bill regarding. If somebody's out to defraud Medicare, they're not going to send the beneficiary a bill because that's going to get a phone call. They're going to bill it through Medicare and call it good. And if they get money from Medicare, they're done. And so they need to read these statements because that's how they're getting away with it. They're billing for services that haven't been provided, or the brace scam that's always active every year, which is durable medical equipment. And we'll get into that. But just that's all that they're looking for. They're also looking for mistakes. You know, they want to make sure there's not something that was double billed, or that, the provider didn't, or the hospital didn't send it on to their secondary and they're getting a bill in the mail. There's lots of things that can happen. And that they also explain some things. Like if they go to a rural clinic, they might actually see that Medicare is getting more money than what they billed. And it's all easily explainable if they just read those statements. Okay. So look for the main things, the dates, the providers, and the services that they received. And then look for anything else that doesn't look right, that's not lining up.
Renee, that's really good advice. So let's just say that I'm reading my explanation of benefits. Now, let me back up and just ask a question. Does that still come in the mail, or is that electronic?
Yes, it can be both. It comes in the mail every quarter if you receive services in that quarter. And the Medicare Advantage explanation of benefits arrive monthly. So you can keep up on those monthly, whereas with the Medicare summary notices, you're looking every 3 months. So you may forget some things between now and then. And so they have given us all a tool to use that it operates in real time. It's on mymedicare.gov, which is different than medicare.gov. People would go to mymedicare.gov and they would sign up and have their own special user site, and they would be able to access their Medicare summary notices right there.
Wow, that is a great resource, and in real time, or close to real time. Yeah,
exactly.
So they've let's say that I didn't see anybody in the last quarter as a Medicare beneficiary, and I get a statement that says Dr. Jones did a x-ray and is charging me for reading the x-ray. What's my first step?
The first step, honestly, is to call the provider. Always call the provider, because one, it may be a mistake and they'll clear it up. But it also might be something legitimate that they need to explain to you so you understand why you're getting billed. But regardless of that, you can always call our office, because if you think about a lot of the fraud, and we are in a low fraud state, and hopefully we will always stay that way, but we know technology changes things. So they might see a provider on there that they don't recognize and don't even know how to get a hold of. Please give us a call, because there are providers that do nothing but sit in their living room and sign orders all day. And it's happened in Montana, and it happens across the United States. And so if it's a provider they know, I see this chiropractor, I see this doctor, just give them a call and ask them some questions. And if it's not something that's understandable, give us a call as well, and we can make some calls for them and help them understand it. And we will always keep track of all of this, because if we do end up with a bad actor who starts out by making these innocuous mistakes, clears them up when they get questions, but ends up with extra money from the people that don't question it, we want to track that, because patterns of abuse develop over time. And that's another benefit to reporting it to SMP, is we will track it. We'll put it in our national database that is accessible to the Office of Inspector General. And as patterns develop, they will be able to ferret them out.
That is awesome. I didn't realize that you had a database like that. That's really great news. And for folks, your Medicare benefits are yours and yours alone. You've worked many, many years to receive them, and nobody should take advantage of your Medicare benefits. That's why it's so important. Read your explanation of benefits. Get a mymedicare.gov account so that you can follow your own information. And always, 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 if you see something that isn't right, make a call. If you don't call the provider, call SMP. They're happy to help. When we get back, we're going to talk about some of the scams that are going on right now, so you can protect yourself even further. Stay with us.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
No one likes to have to ask for help. It's a courageous act.
Sarah Solomon, Energy Share Coordinator.
Our clients work hard, sometimes at 2 or even 3 jobs, but still struggle to keep the heat on. They're doing everything they can. They're proud and they don't give up. I feel inspired and honored to work together with these Montana families.
To donate, call 888-779-7589 or go to EnergyShareMT.com. Energy Share, you can help your neighbor stay warm.
Hello everyone, welcome back to Aging Horizons. We're talking about Medicare fraud today with Renee Labrie-Shanks of the SMP program out of Missoula Aging Services. Welcome back.
Thank you.
Renee, always great to have you. Now, we've talked a lot about what SMP does, how people protect themselves, but let's face it, even though we're a low fraud state, Montana still has some stuff going on that we need to know about, that we need to keep in mind so that we aren't taken advantage of. And I think the very first thing is just medical identity theft. And I know that you work with that some. Will you talk about that a little bit, Renee?
Yeah, medical identity theft. That would be if somebody does get a hold of your Medicare number. And that happens more often than not because of the scams that we'll again talk about. But if people see withdrawals from their bank account that they can't explain, or they're getting bills for services that they didn't use, or maybe a health plan won't cover their benefits, or their medical records show a condition that they don't have. It could be debt collectors are calling about a debt that's not theirs. And there's even unfamiliar accounts or charges on their credit report or their credit card. And we do want people to be checking into their credit reports because that's a sign as well that somebody may have taken their information. And when someone steals their Medicare number, they'll use it as their own. And that can result in, there's things on their records that become permanent, like false conditions. They might have diabetes and they no longer have diabetes. This can impact their health with the age of electronic records.
Right.
Treatments for conditions they don't have. They could have incorrect lab results that show up, and obviously bills for services they didn't receive, or denied services and denied prescriptions because somebody else is using their records. So these are things that really happen if people give out their information.
Okay. Yeah, that's good to know. Even though our Medicare numbers are no longer our Social Security numbers, you really have to safeguard that number.
Yes, because that is still a credit card to Medicare.
Yeah.
So it can't steal our identity anymore with stealing our, personal Social Security number and mucking up that way. But it can still steal money from Medicare, especially when people aren't reading those statements, right? Because anything billed and used in their name will come on those statements.
So Renee, what kind of scams are we seeing? I mean, I'm certain there's some COVID scams, and then there's also some scams that you see on a regular basis. Can you talk about some of those?
Yeah, well, I want to make sure everybody understands some of the common ones. Like there's hospice fraud, where if a patient needs crisis care and that's fine, but if they're billing for a higher level of service than what the person is receiving, and a caregiver might notice that, where their mom or dad is just maybe getting a check once a week and they're wondering why is Medicare being billed $5,000? So just things to check into. They want to make sure everything is legitimate with what services they're receiving. And, I think a big one that people talk about is ambulance fraud and ambulance coverage. And ambulance fraud is real, and it definitely is. But Medicare only covers ambulance services if it's necessary, and they're going to receive treatment. So if somebody, falls down and they just need a ride to the doctor, that wouldn't be an occasion to take an ambulance. That would be if they need their vitals checked along the way, if there's something going on. So it needs to be, life-threatening, basically. It can't be routine. So I think a lot of people get an ambulance, and whether they want it or not, somebody might call on it, and then they take it because they're there. And if the ambulance shows up and helps somebody and gets them stabilized, it might be a question to ask themselves is, do I need to go to the hospital? And if so, can I go there by another means necessary, or ask the ambulance, because they'll know if they'll need treatment along the way. And you don't want to, fabricate anything to get an increased billing. That is fraud itself. So nobody ever wants to become a part of fraud. And again, with Montana, low fraud state, hopefully we will always stay that way. But these are just things people know. And I think most of the ambulance questions that we get are not fraud. They are unnecessary transports is what happens. So people just need to be educated of what ambulance transport is, and take it if they need it, basically.
Mm-hmm. Yeah. And what about, in our last couple of minutes today, Renee, what about COVID? That has brought on just all kinds of new hassles and scams and weirdness in the world. What should Medicare beneficiaries be looking for with that?
Well, they want to slow down anything. Anytime there's a call, whether it's COVID related, a diabetic brace, anything, you want to slow things down. Because if it's urgent, that might be a sign that it's a scam. If it's something they need to provide personal information, like a contact tracer calling to find out, get the trace down to help, stop the COVID, is not going to ask for personal identifying information. They're not going to ask for your health numbers. They're just not. And that's the number one sign that somebody's trying to get information from you, is they're asking you for can you confirm your Medicare number? Can you confirm, your social security number? They don't need that information. So that is something. And only, if somebody's calling from your State Department or they're a health employee, that's who's doing the contact tracing. And don't fall for COVID kits, genetic testing. There's so many out there. I don't even, we could have a whole show just about that. So the main thing to make sure people understand is the main things for all of the calls, whether they're COVID related or not, they create a sense of excitement. You won a big prize or something's going to happen that's great. Or a fear. Fear is a big one. Yeah. And that's that whole, this will save your life type thing. Or pressure, anything that's pressure or sending money. These are signs of scam calls. So
thanks
we just
so much, Renee.
Call SMP.
Yep. Thanks so much. And folks, thanks for joining us on Aging Horizons.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.